Hi, I'm Dr. Sunanda Kane. I'm a professor of medicine at Mayo Clinic in Rochester, Minnesota, and my specialty is in inflammatory bowel diseases. And I thought I would just take a couple of minutes to tell you about a new study that has just come out in the IBD literature in regards to the risk of developing inflammatory bowel disease after being born via C-section. So as of right now, we don't understand what all of the risk factors are and all of the agents that go into somebody developing inflammatory bowel disease, whether that's ulcerative colitis or Crohn's disease. And there had been a suggestion that perhaps if you were born via C-section, that you had an increased risk of developing IBD down the road. And why would this be? Well, the thought was that when you are born via a C-section, you miss the opportunity to get exposed to the bacteria that are in the birth canal of your mother. And that it's important to see bacteria early on in your lifetime in order to have an appropriate immune response and immune environment both in your blood and in your colon. So that because this was a question, that the newest paper that has come out has been in the largest population of IBD patients that are well characterized in North America, and that is in Canada. And the group there actually studied their IBD patients and looked back to see who was born via C-section versus born vaginally, and compared them to patients to people who did not have inflammatory bowel disease. And it turns out that being born via C-section did not increase your risk for developing IBD later on in life. So it doesn't appear that necessarily having exposure as a neonate or as a newborn to mother's vaginal flora or bacteria is as important necessarily as we once thought. And so that perhaps being born via that method is not going to increase your risk for developing IBD.